We're in an interesting time now in terms of shoulder rehabilitation, that we're in the middle of the digital age and the beginning of learning how to capture an exponential amount of data. I think the challenge is how best to use that data to make it relevant for the surgeon, for physical therapists who are rehabbing these patients, for the patients themselves, to be able to understand how this data is valuable and how to assess the recovery. And so as we have seen in the rehabilitation for all different types of shoulder injuries, subjectivity is the basis of assessing how shoulder patients recover. And so I have, for all my shoulder patients that I treat around Birmingham, Alabama, there's about 40 or 50 different physical therapists that help with the rehabilitation of these different shoulder injuries. They all have different assessment methods, and it's different for different subsets of patients. So for our elite athletes who are recovering from a labrum surgery or a rotator cuff surgery, our weekend warriors, our older patients who had a rotator cuff repair, it's important to be able to have comparative, objective data points for patients of a similar cohort to be able to really understand what this data means and how best to assess at different recovery points at 2 weeks, 6 weeks, at 12 weeks, how that patient is doing compared with peers.